on behalf of Global Menopause Collective. I welcome you all to have spared your time and energy and effort to join us on this small little initiative that we've started. I'm thankful to IDA. I'm thankful to each and every member who's joined in this hall for this evening. Starting from the top, I introduce Dr. Moheba Jamosi. She joins us from Oman, Muscat, and she will be discussing about a relationship and psychological effects of perimenopause and menopause on this particular aspect. Next, I have Shri Vidyaji. She's a psychotherapist. She's joining us from Chennai, and she has done some really credible work in this field. Lavon, I'm so thankful to you. It's 4:30 in the morning in the US right now. It's practically, the temperature is minus 13, I'm told. And she joins us from Maryland in Washington, D.C., USA. She has been counseling on menopause and perimenopause and related aspects. Dr. Hitesha Bhatt, she joins us from Vadodara. She is a gynecologist, and more than that, she's a menopause psychotherapist. So during this conversation, we will understand what these terms mean. I have Madhurji joining us. She comes from Noida. She started very early in the morning to join us for this particular session. She's a movement therapist with more than 27 years of experience. Next, I have Amrinderji. She's a burnout specialist. We've been working together for quite some time now, and she is the chairperson for policy and advocacy in CII IWN, Chandigarh. Next, I have Dr. Romika Vadera, a very dear friend of mine. This whole thing was, conceptualized in our clinic a couple of weeks back. And she joins us in the capacity of a dental oral specialist. She will be, I would say, exploring the intersections of perimenopause and oral health. I'm so thankful to each and everyone, especially the chief guests, the guests of honor. Everybody is a guest of honor. But especially the first benchers, I must say. Thank you so much for taking out time. Thank you so much for joining in. Now, I would request Dr. Tripta to come and start the program this afternoon.
Thank you, Harman sir. And first of all, I request everyone please to stand for Vande Mataram. afternoon, everyone. On behalf of IDA Mohali, I warmly welcome all our respected dignitaries, panelists, colleagues, and friends. And thank you all for taking out time from your busy schedules and being here today. Today is a very special day for us because this is not just an event, but a very important collaboration with the Global Menopause Collective, and we are truly proud to be associated with such a meaningful global platform. So thank you, Harman sir, for trusting IDA Mohali. And with this wonderful initiative that is creating awareness and starting important conversations around perimenopause and about women's health. It is indeed a great step to build such hybrid events where we have our brilliant speakers from all over the globe joining us both physically and online. So please give a big hand. Perimenopause and menopause are the phases which affect almost all the women and yet not discussed openly. मतलब बिल्कुल भी इस चैप्टर के ऊपर ओपनली डिस्कशन होता ही नहीं है, and that's why many women suffer in silence. Many women suffer silently. So today's session is an effort to break the silence and to spread awareness and promote better understanding from an oral, psychological, emotional, and systemic perspective. I again sincerely thank the founder of Global Menopause Collective, Mr. Harman Rekhi, our brilliant speakers, and my IDA Mohali team for putting in great effort to make this event possible. So once again, I welcome you all for this wonderful, knowledgeable and engaging session. And now I request all my dignitaries and panelists to kindly help us light the lamp of knowledge. Please, ma'am.
Can you ask Moheba, her recording is off, so she can rejoin again. Yeah. The lady who is coming now, बबीता कपूर जी, इनको कॉपी कर करके मैंने बोलना सीखा है literally. Yes, yes. And I just hope I don't put you down. I don't let you down.
And I think they should take the picture. So just for you. Please, Dr. Shaw, Dr. Balwant, please, give them a big hand. Please come. So you would say the boys of IDA. Boys,
Whatever, we can record you now. Yes, everybody is being recorded. And show me a thumbs up if you can hear me well. All the panelists. Perfect. All right.
Please, no, please. Thank you.
All right. Madhavji, if you can keep that small little mic where your ear pods are. Here, okay. And I would request everybody to maintain silence. If we can, somehow, it will be better if we can switch off those lights. If not, well and good. At the same time, I would just request everybody to put their phones on silent. That's a possibility. Any cardiologists in the room?
Sir, I think we'll have to switch off the light.
This one?
That one.
We can थोड़ा dim कर दो उसको. Right. Any cardiologists? Yeah. Not that we need any medical intervention here, but what I'm trying to gauge is that I want to ask if it's okay to have your heart outside your chest. My heart is right here at this point of time. Seriously. I'm looking at my panelists there and I'm wondering what's happening to them. So right now my heart is not beating, it is pounding. It is thudding against my ribs like it has never ever done, and just like it's got something urgent to say, like it cannot be contained anymore. Seriously. And no, this is not because of stage fright. Gentlemen, young boys, please have a seat, all of you. Right. So are we ready to be transformed? That's more important, because so as I was saying, it is not because of stage fright. This is not fear of faces or lights or a microphone. This is a different kind of nervousness. The kind that arrives when you know deep in your bones that the next 2 hours will quietly, irreversibly alter lives. Lives of the people sitting on these chairs, lives of the people on this side of the stage, and for all those who are watching this on their screens. That something said here will follow someone home, into their kitchens, into their bedrooms, into the conversations they have been postponing with themselves. So before we go any further, I ask you for a small act of trust. Please close your eyes. Just for a few minutes. I want you to imagine a woman. The words you're about to hear were written for her. She walked into our collective a few months back carrying a label she did not choose. Depressive. She was misdiagnosed. One word. And yet it crept into every corner of her life. It sat beside her at the dining table. It stood between her and her children. It echoed in the rooms that were supposed to feel safe. She was told something was broken inside her. And so she began spending her days defending her own wholeness. Again and again, she had to reassure her family, her children, herself, her safe space. I'm okay. There's nothing wrong with me. I'm still whole. Imagine what it does to a human being when their deepest work becomes convincing the world they're not falling apart. Because this afternoon, we are not just speaking. This afternoon, this panel is expressing our knowledge, our experiences, and expressing our faith. And I want you to express with me. I want you to connect with yourselves. Because this afternoon, we are unlearning. And this afternoon, we are going to give language back to hearts that were misunderstood. The lines that follow are for that particular woman. Sri Vidya ji would remember whom I am talking about. In these lines, I have imagined how she would be convincing her own children. Her own children, imagine. So I wrote this for her. And pardon me if I start shaking. Mama, so sorry. Mama, so sorry. She can't seem to get it together. But every day she fights to change and do better. I know there's much you don't yet understand, and so much I long to give to hold your small hand. This poem I write, you'll never hear it spoken, yet guilt weighs heavy, though my heart's not broken. I seem so distant, I know it's unfair. This pain isn't yours, it's mine to bear. But I swear to you, my love's always there. I care more than you know. That's why I'm feeling this pressure. I can't even seem to get the strength to put your clothes in your dresser. And I'm so tired. I can't seem to sleep enough. So I'm sorry for not playing and laying around so much. And there's something I never tell you. It's the real reason I'm stressing. Mama suffers from something the world calls depression. And sometimes it comes back. After I thought I fixed it, it feels like something's pushing so hard on my chest I cannot seem to lift it. And I lose the will to function. Even when I'm trying to fight it, that's why Mama looks so tired. Sometimes I just cannot hide it. That's why some days my smiles seem thin. Makeup masks the storm raging within. I hide the cracks, I shield you from the view, but this sickness grips, I don't know what to do. Some days survival feels like war. Yet your hugs anchor me to life's shore. Those days I'm fragile, your love's my only guide. A compass through fog where hope's hard to find. I'll claw through this darkness, I'll find a cure to show you the way if you ever endure. And when you've grown and the world feels colder, remember my arms, your shelter, your shoulder. Right now, I'm gathering strength from above, day by day rebuilding this love. If darkness ever dims your own way, I'll be your dawn, you'll never be prey. For you, my angels, I'll conquer the weather and stitch my broken wings back together. I turn to Sri Vidya ji. Sri Vidya ji, I mentioned guilt, I mentioned pressure, and I mentioned depression. Why are are these feelings so closely associated with perimenopause, Srividya?
So let us pave the way so that no other mama feels this loneliness. Throughout my practice as a psychotherapist, it has been my observation that whether a career woman or a homemaker, they both share the same desire to establish themselves. Nearly 25 years of a woman's life is spent in the external world, driven by strong desire to achieve. As she touches her late 30s and 40s, she is faced with fluctuating hormonal levels. This phase is called her perimenopause. She notices a shift in mood, monthly cycles, and experiences episodes of low energy. This is the time when her nervous system is harmonized. Through connecting with herself, her family, and co-workers, friends, it can be established through something called regulation. Co-regulation is when the family, colleagues, and even friends support her in managing her emotion, behavior, and physical changes. She could be living away from her family, sharing a flat with other women perhaps. Through the connecting interactions that facilitates her transition during this phase. Her guilt and possibly not being able to focus on her well-being is largely when her family is able to take regulation, the space. The role of co-regulation is to balance the sympathetic and the parasympathetic system. If the family is able to provide the support, then she develops emotional resilience. But if it isn't forthcoming, it faces sensory overload, leading to the pressure and depression that we spoke about. Another delicate area that she faces is the elder woman in the family. In their time, they suffered in silence. Quite a few health issues would have gone unheard of or unresolved. So for her, it can go two ways. The elder woman would support the next generation. She could that this is actually being discussed openly. Or she would be unhappy with the whole thing. This could add strain to the relationship. Women also face differentiation in their workspaces. These are some of the pertinent scenarios that lead to her guilt, her pressure, and her depression. Her need to connect is a strong factor due to perimenopausal and menopausal time.
My idea is, what I wanted to ask you was, this is a beautiful answer that you've given, but what the further progression goes on to is that why do so many women say, I don't recognize myself anymore? Why in this specific phase? Why does this feeling come? As a psychotherapist, what's your opinion about it?
True. She doesn't recognize herself as a changing. Till now, she has built a career, raised a family, or both. During the perimenopausal years, nature demands that shift from being a caregiver to making self-care a priority. From the outside.
Not many people think like that. That's the problem. Many women don't even acknowledge that they are in this perimenopause stage. Leave apart, going further than that, what's happening in this? Why is there's a problem in understanding and accepting that yes, this is a stage to be self-focused. I won't say self-centered, but self-focused.
That's the difference. We think being selfless is being selfish. So because of this, we do not learn to detach from our family and start focusing on ourselves. So we see that as a selfish act.
That's a very important point. Okay. Now I'll move to somebody who's sitting right next to us. Mother, we've spoken about the inability of women in this particular age to start to think about themselves, because probably those patterns have been built over generations and generations, and right? That's how you've been brought up. That it's not okay if you start thinking about yourself, right? Okay, we've identified what needs to be said. My question to you is, when emotions don't get space, the body begins to speak for them, right? Where do you think women store emotions like guilt, frustration, fear during perimenopause?
Everywhere. You know, our body is very receptive. But since we are talking about emotions, most of our emotions are stored in our pelvic area. Yeah? So let's talk about a scenario. All of us, I think, have gone through this. Relationship issues, can't verbalize, can't express, jaw clenching, stomach drop, zipped mouth, bad boss, family issues, kids. You know, what are these? These are all negative emotions. Now, the body is not able to process it because it doesn't have a way to release these emotions. And the most important, so what happens if the body is storing these emotions? What's the body's response? You know, something that we don't even realize but is becoming very common, and that's why we are here, is jaw pain. You get up in the morning, you have this severe headache and you don't realize, oh, what's happening? You know, because the jaw is paining. Second, fatigue. Yeah? We all talk about fatigue simply because it's shortness of breath. I mean, we are all people here from the medical, so when there is tightness in the diaphragm is not expanding, the rib cage is not expanding, we are unable to take deep breaths. And that translates into the pelvic floor. Now, why the pelvic floor? One, because in our anatomy, we call it like a hammock or a sling. Yeah? We all know all the internal organs, especially the uterus, the bladder, the rectum. All those are protected within the pelvic floor. Second, the pelvic floor is a storehouse of emotions. So I call it the home of emotions. Because unconsciously, every time there's a negative emotion, the first thing I feel is, now what? You know, and thirdly, when we talk emotions, we're also talking about the brain. Right now, Shrividyaji spoke about parasympathetic and sympathetic, and we all understand fight or flight. Now, what's the connection? So, the nervous system, there are direct nervous pathways, which are called the somatic pathways, which are connecting your brain to your pelvic floor. And we all know the pudendal nerve, right? We all know that because everybody here is from the medical background. But that is a nerve which fires up And it's constantly on fire because there's so much going on. We are not giving the body the release that it needs, so it's all getting stored in the pelvic. And then how does that translate? Pelvic floor dysfunction, urinary incontinence, UTIs, most common, then you are getting lower back pain. Lot of these, cases I have seen where women are coming with lower back pain, especially the minute they hit 40. Fantastically fit, but lower back pain. Also, when we talk about hormones, estrogen, is kind of depleting, and that's your body's safety mechanism, right? So this is
Now, this you see, before we analyze any further, I would say let's settle the body.
yes, please.
Right? This is exactly what we want to achieve here. So I would want you to bring in a few actionables, if you can, right? So what is it that you want to introduce the audience to? What actionables do you want to introduce?
So whatever I'm going to be doing here, but I really hope that I get a response so that it's not a one-way pathway. Let's create some kind of a connection since we're here. So I'm going to start with doing something which is very, very dear to my heart, and this has been my go-to ever since I understood the importance of perimenopause. I call it grounding, and so can I request everybody to just sit very comfortably. Let's close our eyes. So let's ground ourselves. Feet on the floor. If you want to take off your shoes, it really helps. So remove your shoes. Now let's imagine there are roots going out of our base of our feet. Yeah. And depending on how you want them to be, think of the roots, whether they're supple, whether they are hard. Give it about 10 seconds. And just imagine. Feet are on the floor. Feel the floor. What's the texture? How does it feel? Give it a name. Cold, soft, hard. You're sitting on your sit bones. Drop all the weight on the seat that you're sitting on. Allow the body to just sink into the chair. Relax your arms. Relax your thighs, relax your body. Relax your spine. Become aware of being carried by your spine. Most important, relax the forehead and the eyes. The jaw, mouth and throat. And let's become aware of our breathing. As we inhale, there is expansion. Notice the ribs expanding and relaxing. And the diaphragm is moving along with it. When you inhale, it flattens. When you breathe out, it turns. Your abdomen is responding and expanding as you breathe in and contracting as you breathe out. Now, find a place in your body which feels healthy right now. It can be anything. Now let's give it a color, a texture, a shape. So any three qualities which come up. It will feel soft, strong, bright, light, anything that comes up. I call it happy, my happy place. And now I want you to feel those qualities to spread into the rest of the body. And let's enjoy those qualities. Let's really feel happy. And just allow the body to soften. And imagine you're just feeling very lightweight. Like a sponge. Let's enjoy this feeling for 10 more seconds. And slowly bring it down. Focus back to your breathing. Take a deep breath in. Breathe out. And very gently you can open your eyes. Thank you so much.
Thank you so much, Mataji. You went so well. But I have a question that arises from this.
Okay.
I'm sure everybody has questions.
Yes.
See, we are trying to make a link between what you said and how we're going to progress during this afternoon. So when the body is ignored, it tightens. When it is listened to, it softens. We spoke about breath, we spoke about jaw awareness. How is the jaw an integral part of this whole emotional story?
And this is my favorite part because I actually been in this field for 25 years, but there are so many things that have not really fascinated me, but fascia is something which has really fascinated me. And I think, okay, so coming back to the connection, I see instances of women who are coming with jaw pain and headaches. And obviously when you are going through some kind of emotional imbalance in the body, the conversations can be very, very heavy, because there's so much going on in the body, and unfortunately the lady doesn't understand. So then I give them an example, because for them to understand the connection of the jaw and the pelvis is not easy. So we all have bed sheets, right? So say for example, you had to tie one end of the bed sheet. Yeah? You tie a knot on one end and you have to straighten it out. Yeah? You're getting these folds because the other side is also getting folded. Yeah? Our fascia is like that. So when I talk about fascia, it's connective tissue. Yes, our entire body is made up of connective tissue. We know, it's collagen. Now what is happening? Fascia is in the form of a web. It's a web of connective tissue which starts from the base of the skull and goes down to the ankle. Let's give you another example. So if any of you have walked on a bridge which is not stable, to balance out one side, the other side lifts up, right? Similarly, the body is also reacting to these emotions. Now, what is the connection between the jaw and the pelvic floor? There's something called a deep frontal line. It's fascial chains. So when we look at the entire emotional pathway, we're looking at jaw, yeah, we're looking at the neck, we're looking at the torso, and then we're looking at the pelvic floor. So this is called the deep frontal line. It's one line of the fascial chains. Next, let's look at a tight jaw. So when the jaw tightens, the thoracic region gets affected, which is shortness of breath, our diaphragm gets affected, and there is increased pressure in the pelvic floor area. So imagine when the pelvic floor is taking on so much load and we're not doing anything about it. We're not releasing it, we're not strengthening it. There is so much going on. There is going to be hypertonicity, which is going to make the muscles weak. So when we are talking about constant barrage of negative emotions on a certain area, it eventually does not have the ability to handle these emotions. And then that translates into a jaw pain. So it's very reciprocal. Sometimes dysfunction in the pelvic can cause jaw pain and vice versa. And both these resonate because there are two ends of the chain. Yeah? So we have the jaw at the top and the pelvic floor at the bottom. Yes, Harman?
I want to take it one more step further. Now, since we've started talking about jaw, we've seen the jaw is affected whenever there is a flow of negative emotions. That's what Madhuri explained right now. But then, Dr. Lomika, In your opinion, in your clinical practice, do you observe this particular thing often?
I think everybody, all the dentists would agree to it, that this is the age group when women come to us with this joint is called as temporomandibular joint. So TMJ dysfunction that we call, we all know about it. Even for the non-dentists, we are always, this age group, women are having pain in this area. You have. Ma'am has already said she has. And she's talked about jaw pain. Now, after that, why does that happen? Because of the stresses, we are clenching all the time. How do we take out our anxiety and the stresses? We clench our teeth. So that affects the jaw, this joint, and the pain comes. And now I know in details why. Because of that we have back pain also, and it goes on. You made it so clear to us. And this is just one part of perimenopause or menopause in dentistry that we are talking about, which is jaw pain. But after I met Herman and we discussed about this, there's so many more things related to perimenopausal or menopausal women in dentistry too. The most important is we all know that in perimenopause, the estrogen and progesterone starts to decrease, right? And in menopause, it's like reduced a lot. So what is it happening? It is affecting our salivary glands. There is less production of saliva. So you will encounter many women this age group, they come to you with dry mouth problems, which is xerostomia, we all know. I'm using a little bit of technical language also because dentists know about it. So in the dry mouth, women come, most of they are in this age. And then we have, it affects mucosa also. And we have so many lesions of mucosa. If you think about your practices, you would remember that most of the lichen planus, which is a lesion in the mucosa, they come, those cases come maximum in this age group. There is sensation inside, there are white patches, and then there are thready patches, jahan mirche lagti hain. They come to you with that complaint. So that is also mostly of this age group. And also other lesions like a lot of, there are a lot of, then it affects your bones also. We know there is osteoporosis. So what happens is that the bone which is holding our teeth, it is reduced. So there is recession of gums. Gums, they go down. And आप याद करोगे तो आपके पास ऐसी बहुत ladies आएंगी जो कहेंगे मेरे दांत लंबे हो गए हैं. And because it is the recession of the gums due to loss of bone, and a space is created between the teeth where there is food lodgement and all. And because of the changes in the saliva, there is excessive calcium in the saliva in this age group. So more calculus in the saliva, and there is more deposition of calculus. So you need to come to the dentist to get it clean. And all these reasons, there is burning sensation, burning mouth syndrome, we've heard so much in this age group. Because of their nutritional changes, their taste changes. I'm not saying that all these problems are only in perimenopausal or menopausal women. It might be in men also, because he was complaining that day that even I feel that stress, because when he's stressed, he's also clenching. But you would encounter in your practice maximum patients of this age group in women with these problems. And sometimes some lesions like candidiasis and nerve pains, all these are because of the changes in the hormone, the stresses, the anxieties that we have. But the good thing is, in dentistry, all these problems can be corrected. There is no such problem in dentistry which comes because of perimenopause or menopause, which cannot be corrected. If you have calculus, go to a dentist, get a scale in that. and you must visit your dentist. This is for the rest of the people, and that you must visit them regularly in this age group every 6 months, so that the things can be caught early. Less saliva production, difficulty in speech, more cavities. So there are a lot of things which are associated. So now, as dentists, what we can now see is when this age group women come to us, we'll be more careful, and we'll just not work on the dental part. We'll also work on their mental health. We would suggest to them that they should.
Beautiful. That's a great thing. As you mentioned, I also had complaints. So Global Menopause Collective, it's been about 2 odd years I've been running this. I've understood about menopause and perimenopause far more than a very beautiful lady who sits there. She's my wife. She just walked in. So it's I who is telling my wife now that yes, these are your symptoms and we hold space for you. And as a man, one of the reasons I started Global Menopause Collective was so that men should listen to a man and start to hold space for their wives, sisters, mothers.
Can I add something to it? We are here as women today. We know all these problems. We are just to think about it, that we have to work on it. But next time when we have any such session, we need to bring our husbands or men to such sessions.
Yes.
Because they should know that why we are behaving like that. I've been through this, so I know every one of us either is going through this or will be going through it soon. So the men should always come, because I've met few men who have no idea that there is something called something like menopause or perimenopause. It's so strange when they hear this. So we need to work on that now.
Right. So I've taken it on myself. We'll start doing more of these events and we'll start creating more awareness, not only in women, but in men as well. I come to one of the most heavy parts of this discussion now. I would just request if there's any murmur, if you can just silence. My next question is to Mohela, Dr. Mohela Jamosli. Somebody I really adore. Mohela, I want to ask you, what starts in the body often spills into relationships? Am I right in stating this? And if so, what shifts do you see in marriages and households during perimenopause?
You really like this? Oh. The second one? No. I've got this. This is better.
First of all, you look so nice and you sound even better now.
I'm falling in love with every time I see you.
Thank you so much for this extraordinary opportunity to talk about something that happens to, I suppose, every single woman. But you are right to connect it to relationships, because nothing happens for one member of the family that is not shared, impacting the others. If the mother is happy, or the father is happy, or the kids, it becomes a general collective well-being. And so there is no way we can disconnect our own pleasures or our own pains from collective, particularly when it comes to menopause, because it implies intimacy. And these moments of intimacy need to be moments of relaxation, moments of peace of mind, moments of connection, and not end up being shame and blame. And my view of menopause is that it is indeed, and I acknowledge this, a pain for most women and consequently for most families. But it can also be perceived as, okay, if we call it loss, one of life losses. If we call it a social construct, something that is molded by culture, then so much is molded by culture. And so we need to turn grief into just one of life's griefs. And by doing this, we can, that's my firm belief, turn menopause into practically a success story for the self and for the family. I mean, what husband is going to say, oh, I regret my wife's periods? Come on. What woman is going to say, oh, I loved it when I had my periods on my wedding day, and I was amazed. No, let's face it, I mean, there is pain, yes, but pain that will also rid us from a lot of disturbance and burdensome aspects of life. And what a relief for sports women, for very religious women. Sports women can play sport all the time and not have to stop 1 week.
Especially swimming,
Yeah. And religious women, they say, oh, what a great relief. I can fast, I can pray, I can go to temples and mosques, unlimited. So we should also see menopause as ending a lot of unnecessary pains. Now when we connect it to motherhood, yes, we will always be mothers. If we have been mothers, we will remain mothers after menopause. It does not stop motherhood. And for women who have not had kids because they don't want to, or they couldn't have kids, they would have, believe me, they would have had more time, more freedom, more energy, more money than mothers. So this is always another way of looking at life. We can live pleasures differently.
I love those answers.
I love that.
Monica, you've got a new fan base in India.
Absolutely.
I wanted to say one thing. I was introduced to India when I was 2 years old by my father. He used to take me to Indian films. I was fascinated by your beauty, your dancing, your culture, and this up to now. Fascinated.
Wonderful. And I think we are fascinated by your beauty.
We are so fortunate to have you with us.
Yeah,
So
we are.
I am fortunate to return to where I was at the age of 2. 75 years later, here I am with you. I truly moved
Perfect.
to be in this wonderful culture.
So Madhurji, now bringing back the focus on this stage. Somebody is holding you there.
Someone's got
Is it, Madhurji, is it correct to say the body and mind are not on the same plane during this phase? And if not, how do we bring them together? We won't let you say it.
Can I request this is music, there's someone's alarm going on. So, yes, obviously, this is something which is new for us because it's something which is not a constant. So the body and the mind are at war, because the body is saying mood swings, body is saying fatigue, and the mind saying, dude, this is the first time I'm hearing this. So over a period of time, again there is disharmony, again there is a disconnection. So a great way to bring that connection back is somatic exercises. I will be doing a few and I would request all of you to follow, because just by watching, I don't think you'll be able to absorb as much. I'll go slow, but I would request each one of you to at least try and do a few so that you understand actually what's happening. Because just by looking, they may seem great, but the minute you start doing it, the body is also kind of responding to it. Yeah? So I'm going to come to the center and I'm going to carry a chair. Okay. So where do I keep the mic? Here?
Yeah.
All right. So, just a quick brief. What are somatic exercises? Basically, they work on the nervous system. We've all heard of the vagus nerve, right? Now, that's the communication pathway for the brain and the physical body. And the best way to bring the connection back is to do a bunch of these exercises at any given point of time of the day. The tendency is, because our go-to are not defined, we find different things. Okay, headache hai, dawai le lo. Neck pain hai, let it be. It'll get sorted out, so on and so forth. So, I'm going to share maybe 3 or 4 of these exercises. Please, I request you to at least try and do these as much as you can, because they are very simple. And the beauty of these are things that we have been doing or we tell our children not to do. A simple exercise like this. We're sitting on the dining table and our children are constantly doing this. Why? Have you ever thought about it? They have so much energy. There's so much energy. So a great way to kind of work on this is just bob, 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 bob. Now, first palms up. Bob, 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 bob. Let's count, guys. Good way to know your breathing is to count out loud. So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Calm down. 2, 3, 4, 5, 6, 7, 8, 9, 10. Palm up. 2, 3, 4, 5, 6. Louder. 7, 8, 9. Last one. Down. 2, 3, 4, 5, 6, 7, 8, 9, 10, 10. 3 deep breaths. Everybody, breathe in. Open up your rib cage. And breathe out. Next one. So, most of the time we are in fight or flight mode, right? So what's happening to the body? We're constantly ready to run. And what are the muscles that we're using to run? Calves. So let's work on the calves. Dig your heels in. Yeah. Just dig your heels in. Try to break into the ground. And along with that, swing forward and backward. Our body kind of craves movement. And how much do we move? Productive movements. Not standing in the kitchen. That's not productive. Most unproductive. But we have to do it. So let's dig in our heels. Try to break into the floor. Breathe in. Expand your rib cage. Breathe out. And close. Next. So we've got 3. The last one is my favorite. I call it self-love. Yeah? So take any of your hands. One hand on your forehead. And the other one at the base, occiput. Yeah? And just enjoy the feeling of the hand. Relax your body. Relax your elbows. And see what's feeling. Do you feel vibrations? Do you feel heat? Do you feel nothing? Do you feel anything? What's going on? Close your eyes. Take a deep breath in. Hold that. It should be minimal touch. A touch which is not a stressful touch. Gentle pressure. Stay on it. Sometimes the elbows start rolling. That's okay. Stay with that. Breathe in. Open up your chest. Open up your rib cage. Expand the rib cage. There's so much space for it to go. Breathe out. And bring your hands down. Thank you so much. How did it go, guys?
Somebody is becoming very popular in Chandigarh. Good job. Now this is, again is on the heavier side now. I would request silence when we are discussing heavy things. Amrinder ji. A woman in her 30s, 40s, early 50s, her career peak, caregiving pressures, social expectations, personal ambition. In your opinion, do you think burnout is justified at this stage?
How is everyone feeling just now? Good. So you are not low on your energies. Madhuji has already pulled you out of that burnout stage, I would say. See, I'll explain this, Madhuji, from my own lived experience. Women in their 30s, 40s, 50s, they are actually at the very busiest crossroads of their life. See, professionally, they are expected to perform, and their performance is gauged, which is they're supposed to be at the peak of their careers in 30s, 40s, 50s. Some of us would be in the leadership roles. We're trying to make big decisions and give performance at the constant level. While we are doing that professionally, even at the personal front, you know, life is very demanding. Most of us, you'll agree with me, that we are raising kids at home, we are looking after, supporting the aging parents, we are managing finances, we are managing households. As Mohali just explained, we are managing relationships and social expectations. But when she has a burning desire from within to grow, to excel, and to achieve something. She basically wants, to go out and tell the world that she has her own identity. So burnout definitely happens at this stage. Why? Because demands both from the personal and your professional front, they are getting stacked, they are simultaneous, and they are constant. Because a woman is juggling between these multiple roles all the time without giving a pause and where she can actually breathe and think about herself. And another factor that I would like to bring in here is women have a habit of taking on everything gracefully without asking for help. And in the audience, I have a very dear friend sitting right here, and she's a lived example. If you could just stand up, Mrs. Soni, let people know how graceful you are. And she's one woman I've always looked up to. She will go to any limits to do something and not ask for help. Why we do that? Because our social conditioning is such that we are selfless. We think of others before we think of ourselves. So that self-sacrificing nature is something which has become inherent into our thought, which actually stems from a very young age. So when you ask me that is burnout justified, we should actually think of what we can do, what changes we can bring in to have this burnout felt less by the women. To me, burnout is actually not a failure. It is not a weakness. It is something, if it is supported well and understood by the society, understood right in our workplaces or at home by everyone, burnout can actually become a turning point from a breaking point.
I'm coming to Dr. Hitesh. Dr. Hitesh, first of all, thank you so much for joining us. You've really taken out time from your busy practice. My question is, as a gynecologist and as a menopause psychotherapist, is perimenopause a tougher phase than what we acknowledge?
Hello everybody. We listened about burnout and basic nature of a woman. Right. I don't know whether it is tough to acknowledge, but I would say that it is lack of awareness about the symptoms which is causing the problem. Menopause is there. We are at the peak of our career, we are at the peak of our family life and everything. And suddenly like a bolt out of the blue, the symptoms strike. I can make from my own example that I being a gynecologist, everybody expects me to know everything about menopause. But when I passed through this phase, I was clueless. Of course, that was 20 years back when not much was talked about menopause to this scale, and we were not taught much in the medical school either. And it is not taught today also. So, what I want to stress to all the women is, when we say ignorance is bliss, that doesn't hold true for menopause. There are two things which we need to understand. One is awareness
about the symptoms, what is menopause, what it causes, inside out. Like there are physical problems, there are emotional problems, there are psychological problems. We need to know everything about it. And second is to take charge about our cells, our body, mind and soul. So, by awareness, I would like to stress is knowing about the symptoms. You need to get yourself investigated. You need to go to a doctor to know everything. Because how we spend these 5 to 7 years is going to frame our next 25 to 30 years. Whatever efforts we are going to put in now, they have to be sustainable efforts. There can't be any shortcuts. Like if I have bloating or if I'm having weight gain, there's no shortcut. There's no temporary thing. It has to be a sustainable thing because the estrogen hormone which is gone is not going to come back. We have to live in this for the next 25 to 30 years. We see so many cases of hypertension, hypothyroidism, diabetes mellitus, joint pains, arthritis, all in this age group. So the psychological stress, what Dr. Madhurji and stress, it is true. But then if we don't take charge of ourselves by lifestyle management, by holistic management, then this will stay with us and cripple us in the later age. So I would not say that we should we need to acknowledge it and take charge of it so that we are the masters. We no longer need to be sorry about menopause.
Absolutely. Motherji, I keep telling you. I know I'm going to be scolded first.
No worries. Please.
We've heard about lifestyle regulation. We've heard about what all should be done theoretically. What do you do?
So I'm just going to share something very quickly. So I'm a very actionable person. So every time he would tell me, give me this spiel, ma'am, ye, मैंने कहा करना है, इतनी knowledge है. What do we do about it? How do we put it into practice in our daily life? So she said consistency, right? What is consistency? Weight gain. Consistently insomnia. Consistent hot flashes. Consistent urinary incontinence. So, two things that I'm going to share, and actually I prefer doing those. Very moderate body resistance training, simply because estrogen's gone, body's protective shield, I call it the cat shield, is gone. What's happening to the joints and the bones? What's happening to the fascia? Are we hydrating the fascia? Are we preventing our body from these aches and pains? And it's not only about menopause. I think in this day and age where, daughters and young girls, puberty is coming so fast, it has to become a part of our daily life. Even body weight. Like I was sharing with Harman, his daughter is maybe 12 years old, but she's carrying a bag which is 25 kgs. And that's ridiculous. Now really we can't do anything about this bag, right? But what we can do is ensure that our children have the strength to be able to take on that load. Right? Now the actionables, I'm going to share 3 very, very important strength training exercises and 3 mobility exercises. They are easy and simply because with all our tight schedules, I at least don't have time to go to the gym and spend 45 minutes. So this is something that I do at least 3 or 4 times a week, and it doesn't even take more than 5 minutes. But yes, you do need some equipment with this. So I am going to use a loop. So these are the 2 things which are handy and I always carry them, especially when I'm traveling. And can I pick up the chair?
Sure.
Okay, so 2 larger group muscles, simply because a lot of the work is done by the quads and the hamstring. Now you're sitting in a place, right? If you have this loop, all you need to do open your legs a bit apart. So if you don't have a loop, you can try. I'm just going to lift my legs up. No? Not pretty. Okay, so let's go. Up, down, up, down, up, down, up, down, up, down, up, down. We are working one of the largest muscle groups, and also since the metabolic rate drops. So very minimalistic resistance training, because if somebody is not used to do any resistance training, all of a sudden you're lifting up 5 kg weight, dude, your shoulder is gone and your back is gone. So let's start slowly. So this is the first line of resistance that I would suggest. They're very easily available. So that's one. Now, the next one is place your legs hip-width apart, your knees and your ankles are all in line, and all you're going to do is open up your legs. These are all very gentle, isometric movements, which are not, they are not going to, if they don't benefit, they will not give you an injury, right? And the only way they benefit is if they are done in correct form. So that is very important with any strength, resistance, body weight training, okay? So here we are working the muscles of the hips. Very gentle movements, place your hands on your hips. You should be able to feel the side of your hips contracting and expanding. So there should be a contraction. Breathe in, breathe out, breathe in, breathe out. The next joint which is completely ignored and which is one of my favorite joints, simply because this is the only contact point with the ground, the foot, the ankle. And how many of us actually kind of work with the ankle, even when we are in training, if anybody's been training. So I like to work with the ankle as well. So again, same thing. You are just going to out, in, out, in, out, in, out, and in. Yeah? So these you can start with, and then slowly, gradually, you can move up towards the body and start working at least twice or thrice a week with basic resistance. Now, 2 mobility exercises which really work with engaging the fascia and hydrating the fascia. We all do the figure 4, right? We all do that. Now we know that it's a great stretch for the hip. But if we had to add a thoracic extension, we've got the entire spine also working. So a lot of the times when people are in office, I always suggest that, say for example, this is a table. It's on a height. May I turn this chair around?
Sure.
So if my table is at this height, okay. This is my table height. And I am sitting like this, right? All I'm doing is extending myself. So I've got a great spinal stretch. So that is working my mid-back. It works for my posture. It works for opening up my shoulder blades. And it's helping stretch my knee. Yeah? The next one. Should I stay in this position if this is okay? Yeah? Alright. something that a lot of us, especially as we age, the minute you turn, you start getting a cramp. Yeah. Why? Can anybody answer?
Lack of water. Hydration of fascia. It's not water. So fascia is collagen. Collagen needs hydration. So hydrated fascia is happy fascia. So less cramping. So therefore, to ensure that the fascia in our mid-back, the thoracolumbar region, is hydrated, very simple exercise again. Place your hands across your knees. Everybody can do this. Bend forward, open your legs a bit apart. Yeah? Just take your hand up. Stretch, breathe. Don't forget to breathe, guys. Hold for 5, 4, 3, 2, 1. Drop down. Switch sides. Take your hands up. 2, 3, 4, and 5. Drop down. So these are some movements that we can do. We all know spinal twist and all, but sometimes when we are doing those exercises, we are cramping. And this is the reason why.
When your recording stopped, did you do that?
Can you mute Moira? Moira, can you mute? Moira, can you mute yourself? Thanks. She was sending her blessings.
Yes.
You need it.
All right, so thank you so much. If any of you have not started, doesn't matter, start today.
Yeah.
It's never too late. Yes, thank you so much.
And you're not done yet, I'll keep coming back to you. All right. I turn to Lahon. Lahon, first of all, thank you so much for joining us at such a early hour. 4:30 must have been when you logged on. Thank you so much. She's got something really worthwhile that everybody needs to hear. So all that we've heard till now, Lahon, all that we've discussed, what's your take on that? And I want you to relate all this to your personal journey.
So I have to say, I have known all of the beautiful women when I was like, that's all I have to say. I mean, I have known that what they were talking about today. I was so much fun that we were in. So, first of all, I want to say, I'm on the side and post-menopause. So if you can survive it, if you do it on the other side, okay? Life is great. But I don't talk about my perimenopause journey. The way I would describe it was gradual, but surprising at the same time.
They came on one by one, but they were surprising because when they hit me, I didn't know where they came from. And I didn't have the words, the language, the names of what I was feeling to even have these discussions with a psychotherapist, even with my gynecologist. And that sent me into this spiral. So I feel like I had at least 15 symptoms now that I know, and I look back on my journey and I can quantify what those symptoms were. I had the top ones like the weight gain and the joint pain and the hot flashes and the mood swings. But then those also went into some of the other things. I had knee pain and joint pain, and I had hip pain. And I didn't see those connections. I also had tingling in my fingers and in my feet. I had itchy ears, dry eyes. I had the burning mouth syndrome, which was talked about earlier. I had weird smells. My hearing was pronounced sometimes. I had frozen shoulder, which was brand new to me. And so all of these things were happening to me in a course of about 7 years, gradually. And I would wake up and I would say to myself, what is it going to be today? What is it do I have to deal with today? And I had not made those connections. And so what started happening is I started to treat each of those symptoms singularly. And I was not looking at my body as an entire unit. And I was not seeing the connections of how all of these different symptoms were connected. And so I spent a lot of time and a lot of resources. I went to different doctors and specialists, and nobody was connecting those dots for me to show me how my body is one whole beautiful unit and how one change in one symptom affects the others. And everyone was trying to treat each one of those symptoms individually, which created even more chaos, anxiety, and it just became unbearable at a certain point. And so what I want to advocate to all of the women and to the men that are listening, from my journey, what I've learned is you have to keep track about what's happening in your body. You have to write down all of those crazy things that you're feeling and sensing, and you have to talk about it, right? Because you may not have the words to say, oh yes, this was frozen shoulder, which I had. I just kept saying my shoulder hurt. But as you start to write these things down and you start seeing your healthcare practitioners and they ask you what's happening and what's going on, you're able to say, you know what, this has been different. This is making me feel strange. I'm not feeling like myself, and this is why. And then also be able to say, and on top of that, these are the things that I have been trying to solve the problem, because sometimes we try to solve the problems on our own, and that may not be the right solutions for us. So I advocate to all of you to pay attention to what's happening in your body, write it down, be specific as much as you can, and speak to your doctors when you see them, and others as well, because we're beginning to talk more about all of these symptoms in perimenopause and menopause. Harman, I can't hear you. You're still on mute.
Can you hear me now? Right. Now, perimenopause, we discussed earlier also, perimenopause is not just one problem. It is many messages asking for attention. Right? That's exactly what we're trying to suggest here as well. How do we take this perspective towards preventive care? We need to discuss about what's to be done after all. I mean, fine, we've understood what it is. We've understood that, yes, this needs attention, this needs acknowledgement. But then how do we progress towards addressing it?
What I just mentioned in making sure that you are documenting, you're writing down your symptoms. You may not know what to call it, but you know that you feel off and you feel different. And have those conversations with your doctors. And I know here in the US, we have preventive care in that we see our dentists twice a year. Don't skip your dental appointments, go to those. See our gynecologist at least once a year. We have certain tests that we are supposed to be doing, especially if you're older. Women over 50, we're getting colonoscopies at this point in time. Over 40, you're getting your mammograms. So don't miss those appointments, because that preventive care is an opportunity for you to have a conversation with somebody in a medical field about anything that seems to be off, right? because unless you talk to somebody that's an expert in this field, you may think, oh, that's normal. They're going to be the ones that's going to tell you, no, I think that's a little bit abnormal, and we may need to do additional testing, or I may need to send you to another specialist. And those things are very key. And I also want to touch on the mental aspect of all of this, because we did talk about this earlier. That creates all of these symptoms become triggers. So one thing goes unchecked and it leads to the other thing, and it keeps becoming a cycle. And eventually that becomes a mental load that we need to also address. So preventive care also includes taking care of yourself, your brain and your heart. You need to have those conversations with others in that social community or in the medical community, where you can have those conversations when you are not feeling well in yourself. And those are important too, as part of that preventive care.
Okay, so do you agree that emotional accumulation creates toxicity? Do you agree to that?
Now that I've gone through all of this and I'm on the other side, what I realized is all of the symptoms had been manifesting for me in this chronic pain that I had in my joints and in my hips and in my lower back. I truly believe that, because everything that was happening to me all the time, it was a continuous circle. I was continually stressed. I was anxious. I was trying to figure out what is wrong with me. I thought I was going crazy. And it was just a cycle. And the more I felt like that, my shoulders got tight. When your shoulders get tight, you start hunching over, your posture is bad. All of that was that negativity that was like flowing through my body. And it manifested itself, for me, I think, in my hips and my lower back. And once I started to relieve myself of those symptoms, my body started to move better. I felt more alive, and I felt much better generally. So yes, I do believe that it builds up into a toxicity.
Now I turn to somebody again. We see toxicity, we've understood, acknowledged, but Karnataka, what do you do?
So, lymph nodes, yeah?
Yes.
Bloating. So sometimes, a lot of us get massages and we have pain. Why? It's lymphatic fluid accumulation. You want to share a little about the lymphatic drainage system?
Lymphatic drainage.
So
I think you are the expert.
Go pump. Narmade, he gave a very nice example. Our body has pumps, right? We have the skin, we have urination to excrete. But how do we excrete? How do we get rid of lymphatic fluid?
You got no pump for that.
We don't have a pump for that. So again, now for this I'm going to ask everybody and insist that everybody stand up. Move your shoes. We're going to move.
Someone can come here and rotate this.
Yeah.
And then we can just
Music, please.
Sure.
How can we do anything without music? How? Let's go. Bounce. 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 Allow the body. Come on, let us toes in the armpits. Come on, move your arms up. Up and down. Up and down. Up and down. हम कभी ये सोच भी नहीं सकते थे ना कि ये जो movements हैं, they're so easy. Spinal twist. Let's go. Nice. And the last one is great for the groin. Now, and clap. Now, and clap. Now, and clap. March, and clap. Last four. 4, 3, 2, 1. Breathe in. And breathe out. Thank you so much. Thank you so
Still breathing. Everybody. So the AC is effective enough?
Somebody was feeling cold, so I said, okay, let's move.
I hope this helped. Give you the perspective of how all we should be actually addressing our bodies. Shaken up the audience a bit. Right.
That's the plan.
So Madhurji, I'll move to Dr. Hidesha. Dr. Hidesha, we have addressed why does this toxicity build up? Because of emotional overload. It builds up. We've seen where all it is stored. How do you get rid of this once? But then how can women prevent toxicity from returning without feeling overwhelmed? What is the preventive care about this?
Yeah, so till now we understood that yes, it comes unalarmed, as once you really get overwhelmed because you don't know what's happening. So what I mentioned was aware of what's happening with your body. By understanding the symptoms and getting yourself investigated thoroughly, taking advice from proper sources and not from influence that I always stress, because these days there are lots of channels going on in the social media where people freely share the knowledge. But please go to authentic people. And as Madhurji said, we have to inculcate lifestyle changes in the form of diet, exercise, and our mental well-being. I'm not going into any details, but they have to be sustainable efforts. I only want to talk about the mental fitness, what I underwent, how I transformed myself, because I was also having a very bad phase. I could not decipher what's going on. There was terrible brain fog. I used to get lost on the road. I lost around 7 to 8 kgs of weight, and I had a very bad palpitation and all those things. Of course, the investigations used to be normal. So anxiety obviously builds up. But what I have found over all these years is, if you are inherently a bit anxious or phobic or say scary, which of course I've seen in many women, for no reason they get super worked up. In those cases, anxiety was more than in normal women. That is one thing. And how to get rid of it? We already saw that emotion sits in our body at different places. And in our scriptures, we call it Chitta Sanskar. Or we can say the programs of the subconscious mind, which the modern science says. So how I work is through hypnotherapy, where we induce trance and give suggestions, and we help the brain to reconstruct the pathway to how we react to the event, to the situation, to the person, to our symptoms, and in that way our brain undergoes a neuroplasticity. Our brain has a tremendous capacity to transform. Of course, we have to take medical treatment, we have to take whatever is required, but after that, for a sustainable effort to get rid of anxiety, of the phobias, anger, all the aches and pains, the chronic diseases which might have crept in, we need to get rid of these piled on emotions. And I have seen very good results with hypnotherapy, where we induce trance. We give suggestions depending on the problems of the patients, what they say, the major issues that they are facing. And by practicing this, we can transform the way we react to it. So this is what I always, this is what I advocate. And by developing such a pathway, our reactivity to the symptoms decrease. Like as Lawan said, if we get a hot flush in the middle of the night, we might feel that we are having a heart attack. If we are not aware that this is hot flush, or if it occurred first time itself. So one thing is, as she mentioned, writing down, and another thing, getting it sorted, and then decrease our reactivity to it through hypnotherapeutic practices. So this is my take on sustainable efforts.
Perfect. So we've seen how do emotions turn into toxicity, where is toxicity stored in the body, what can we do to release it immediately, and how to kind of prevent it from coming back. What workplace changes can ensure women feel safe and healthy? Going back to toxicity, the source of that toxicity was feeling abandoned. The source of that toxicity was negative emotions, and probably somewhere the woman was feeling that I'm not safe in this particular environment. So my direct question to you is, what workplace changes? You are a chairperson of policy and advocacy with IDA. How do you plan to change this scenario? And what changes can ensure women feel safe and healthy?
Most importantly, before we talk about the changes in the workplace, first thing I would like to suggest here is that we need to normalize these conversations.
Absolutely.
We need to actually sensitize our society. And how do we do that? We do that by bringing in education into our communities, into our workplaces, into our societies, and at home. And another factor that I look at is, empathy really matters. We need to be empathetic towards women. Empathy does not mean that you're going to give us a and your manager or your colleague turns around that you're not feeling up to it and just says, are you doing okay? You seem to be really stretched out. Do you want me to help you? That pause makes a woman feel that she's been noticed, she's been seen, and she's not being judged. So the changes in the workplace that we can bring about, where women can actually feel safe and held, I would categorize that into, say, 5 major categories. First is time. Give her time. When I say time, if you are giving her time, respect her for that time, and don't have expectations that she will be available 24/7. Right.
Absolutely.
Yes.
Absolutely.
allow her to take some rest. Allow her to do the work at her own pace. Because in case you don't allow her to take rest, she will carry that burden back home, which is causing a direct stress on the mind. Similarly, managers should be, more focused on when they see that these are the problems with the subordinates or their colleagues, they should give them little flexibility in work. It could be you can offer work from home scenario. You can probably do some kind of workload readjustments within your own teams. I'll actually give you some statistics, which is very interesting. Recently, in a Global McKinsey Health Institute survey, where 30,000 employees across 30 countries, and 22% of the employees reported that they were experiencing burnout symptoms at work. And those symptoms were due to workload, excessive workload, and time pressure. And in India, the rate was much higher. It was close to 60%. Second thing I would say is movement. Motherji has very, very beautifully explained about what movement is all about. I don't need to talk about that. But yes, in your workplaces, it is very important for the organizations to create spaces which could be recreational rooms. You can say you have a small gym in the office where if you need to unwind, you can go out, do some of these kind of stretching exercises and then return back to your workstation. So all these should be made available. Then I'll talk about space. By space, I don't mean to say only physical, it's emotional space as well. See, psychological safety for a woman is very, very important. She'll only turn around to her manager or her boss with a problem, provided she knows that she's not going to be judged. If she'll only confide in the manager for that purpose. So psychological safety should be brought into the workplaces where we need to educate the managers, the supervisors in the organizations. Then for spaces, we should have some sort of wellness rooms available in the office. If I go back to my school days, I very distinctly remember we used to have a sick room in the school.
Yes.
When one particular subject I did not enjoy, or there was some test I am not prepared for, so you start thinking, oh, now I will have to take an excuse. Yeah, I have a stomach ache, ma'am, I have a headache. But you could be given that provision here, where for that particular time period, you are in the sick room and you have an escape from that. You're lying to your teacher. So similarly, if there are wellness rooms created, in the organizations, women don't need to go back to their managers when they're having these kind of perimenopausal symptoms going on, They have some stress, they have hot flushes. They should just be able to get up from there, go into that wellness room, rather adjust the AC as per, your body temperature, relax for a while, and then come back to your workplace. Then, see, there is another research on this, which is on mental health first aiders, England. They did this with 2,000 working adults across UK. And 49% of the women did not feel comfortable expressing their needs at work. 35% of the women said they did not feel safe asking for help. 15% said that they could have made those preventable mistakes because they felt it was unsafe for them to speak up. So that means 1 out of those 7 employees was already making more mistakes due to stress and fear that she'll be judged if she goes and lets her manager know about it. Then comes your recognition. Everybody wants to be recognized, each one of us. And we are not looking for, say, an annual award ceremony at the workplace in your organization where you will be recognized. No. Small recognition moments where your colleague or your manager can say, oh, that presentation was beautiful. The report that you made was extraordinary and probably our external clients loved it. So that feeling of acknowledgement where you feel that it has been noticed what you've contributed, that is a feeling where you feel you're valued. It's very energizing. Vis-a-vis, if we say we're feeling invisible, that's exhausting for you.
Absolutely, absolutely. I'd like to bring in something more.
Just a second, I have a very important point. One last point. Shared responsibility at your workplaces. Workplaces, when we say we need work time adjustments, we say we should remove working, remote working should be made possible. You know, lot of organizations in the corporate sector, they have well-being roles now. I expect all the educated ladies sitting here today. We've got healthcare specialists, we've got doctors, we've got entrepreneurs, we've got each one of you in the room. Please go back to your HR and ask them that why can't we have a menopause advisor or a perimenopause specialist in the organization.
Wonderful. Brilliant.
And world is moving ahead, you know, where the well-being roles have been created. We've been talking about DEI roles where you have diversity, equity, inclusion. Why not menopause advisors? Because those are the people who will step in, try to frame those policies at your workplace. And being the chair of CIIWL, that is my motto, that is my mandate.
Wonderful.
That if I can bring in one policy, that would be good for women. And it's not that, it takes you years, you know, to build up these policies. Menstrual leave you would have all heard of, but that's recognized now at the state levels. Although it's not gone up to the national level, but states have started recognizing that. And Karnataka is the first state very recently in India. In 2025, they've introduced 12 paid leaves. That means 1 leave per month for all the government and the private sector women.
Brilliant.
And we are looking forward to that at the national level, you know, menstrual leave, some sort of law would be made eventually. So that's why I'm asking for menopause advisors and perimenopause.
And you're in the right space. You're in the right space. You're in the right space. Before we move on further, I'll give you a perspective that's never been spoken about. And this particular perspective, I owe this to an international author we have in our collective. She's from New York. She's a best-selling author, Shweta Vikram. She gave me this phrase. I'm going to use this. Just picture this. For years, able to create life felt like great compensation. Now, whatever the body lost would be redeemed. Lost sleep would have meaning. Right. Lost sleep would have meaning. Lost hormones would feel purposeful. Even failing social gaze would soften because there would still be an ancient role anchoring her worth. I'm talking about motherhood. You may not want it altogether. You may not want to live it again. You may not be certain, resolved or relieved. But resolution does not erase grief. Because what is slipping away is not desire, it's possibility. The deep cellular knowing that motherhood was still available to you if life ever asked. This attaches to your self-worth. Perimenopause does not announce this loss, it arrives quietly. As hesitation in the body, as emotions that overflow, as sleep that fractures, and beneath it all, a truth you were never asked to release. Even unused, it mattered. Moheba, if you can just switch off your mic, please. If that's possible.
Yeah, I think you can hear me, yes?
Yeah. You can just switch off the mic for a little while, please.
Sorry.
Yeah. Even unused, that sense mattered. It gave you spine. It made sacrifice feel justified. Pain feel sacred. Exhaustion feel earned. Now that spine feels missing, or I would say softer, or even no longer dependable. There is no ceremony for this moment, no language that says something powerful has ended. Just change without permission. Grief without a funeral. You're not mourning a role you plan to perform. You're mourning the closing of an inner authority, the quiet sovereignty of knowing motherhood was still yours to choose, if you ever gave it a chance. What that power diminishes, when that power diminishes, a woman is left facing an unsettling question. Who am I? Who am I when this form of meaning is no longer possible? Society does not name this grief, so you carry it inward. It settles in your body, it settles in your psychology, it settles in your identity. This is grief without a funeral. And learning to live with this is one of the most invisible acts of courage a woman ever performs. I turn to Dr. Moheba. Moheba, my question that I'm about to ask you is not about fault. It's about understanding a grief that has no public language. When a woman is grieving inwardly, unsure whether she is mourning her body, her sense of self, or the quiet closing of motherhood as possibility, how does that unnamed grief ripple through the home, or to a partner who cannot interpret her distance, and to children who absorb her frustration without understanding its source? And in this silent triangle, what is actually dying? The relationship, the roles, or the language between them?
Well, thank you so much for reading this poetry. Can you hear me? Yeah. Thank you for reading poetry, because this is poetry to me. It's a brilliant poem about pains. You are adding, not only are there physical pains, but also emotional pains. There are also profound, deep pains that have no name, as you said it so clearly. And of course, when you are going through such a period, and Levon beautifully well described the horrible state some women go into, what is it you can do? Your words remind us of total disempowerment, because you spoke of losing your worth, your power, going through grief that has no funeral and no name, and losing choice. I mean, if you lose choice, what is left? Losing your very identity. What is left? The final loss is losing your identity. Now, of course, this is disaster, but it has reminded me of another poem by an extraordinary poetess who spoke of one art, the art of managing, mastering loss. And this is what when we go through this perimenopause, menopause, we need to master loss and consider it is one loss among many, because indeed
We go through life with so many losses. We lose friends, we lose relationships, we lose sometimes jobs, health. So we learn how to master loss. And how does it happen? Well, we master it by simply transforming grief into no to grief, into considering that many aspects of menopause are real pain, real physical pain and emotional pain. We also need to remember that menopause is our own social construct. We put layers on top of layers on top of layers on menopause, so that, as Levon explained, and all of the participants, thank you, have explained that, A, we need to become aware. Awareness helps. Knowledge helps. I remember all these wonderful words. Transparency helps. And keeping it to yourself does not help. Being silent, quiet, does not help. And so you need to express your emotions. You need to be transparent. You need to know who you truly are. Don't be who others want you to be. And therefore, transform what you can transform, and the
menopause will be much easier.
Wow, wonderful.
That's for others.
Wonderful.
Yes.
Now going directly to Srividyaji, no sugarcoating here, I won't sugarcoat things. Srividyaji, a direct question to you. Why do women hesitate to ask for help at this stage? Why does external validation overpower inner calm? Why do you always keep looking for external validation? What's happening here?
To endure pain and suffering is a deep-seated conditioning across ethnicities. It's not just us Indians, it's across the world. We don't like to ask for help because nature and nurture play their role. During early years, if we are, when we approach our parents or any of our caregivers, and we see that they are okay, they are open to helping us, then that sits in our nervous system. Whereas when we are given rejection or irritation, then fear gets stored. This is where the generational wounds needs to be understood. Parents of the 80s and 90s grew up with parents who themselves were brought up where vulnerability was looked down upon. Our moms were told to suppress and befriend silence. Survival became the priority, and emotional connection took a backseat. So this is why I spoke of co-regulation. The memory of our nurturing is lodged in our autonomic nervous system. And if we give the space to the woman, then that normalizes seeking help. And this is what our next generations also going to learn, because they learn from observation, our daughters. If the moms are not given space, then the daughters also do not learn how to give themselves a space and to also ask. Asking becomes difficult. It's looked down upon. You're supposed to be a weakling if you ask for help. But we need that help. We need our family support. We need friends. And we need our girls.
Absolutely. Absolutely. There's another concept, Madhurji, and it's waiting for you. The concept is that when you come back home from working, from your office, from whatever life is keeping you busy with, just don't come and join the chores directly. There's a buffer zone in between. Decompress. What do you think of this concept? Decompress before you get back into your safe space. And whatever you think of it, what do you do about it?
Quickly, I think all of us are kind of this too much heavy work.
We've taken it a little
I think it's very, very tough to decompress because you are late at home. I mean, this happens with me. So twice a week I'm in Delhi, I stay in Noida. I have to rush back home because I have to make sure that my kids leave for office at 8:30 in the morning. So I come back and
earlier I would just run into the kitchen, and then I used to realize that I can't function because I'm at a place where I cannot multitask. So, 2 things I have made sure that I do. I'm sharing with you. These are my go-tos no matter what. 2 exercises which will help you decompress, and I think uske baad then we can. So, simple. Just, and that's it. If someone has cervical issues currently, I suggest you can do these. But just allow your body to drop down. You know, it seems funny, and my kids used to ask me, what the hell are you doing, Ma? I said, give me 2 minutes. Just give me 2 minutes. So this was something that I would do, just a spinal to allow. Also, the ground is absorbing a lot of the forces.
True, very true. Very true.
So if you just allow the body to let go, and something which is like a full body stretch, I'm going to show this against the wall. It just stretches your whole body, and this is something that I keep doing in the kitchen also. So say for my back will be right.
No
Is that
issues,
okay?
no issues.
Yeah. So okay. So both my hands are on the wall, so I catch hold of the kitchen wall, and I just bring one leg forward. So I've got the lower, and I just drop. That's it. Switch sides. Full body stretch. Last one, which is very, very important, and at our age, we need to do a lot of pelvic movements. So you can sit on a chair, but I like to use the gym ball simply because it gives me more movement. So I'm just curling my pelvic in. So, and then you let go. So it's like a 12 o'clock. And it's not a Kegel, because most of the time doctors say Kegel karo, but if your muscles are already so tight and there's so much of tightness and stiffness, Kegels is not going to help. So all you just need to do is allow the pelvic floor muscles to relax. And why the gym ball? Because the gym ball itself is giving you a great massage. So these 3 things, I think all of us at our age and beyond, because my mother has started doing these now and she's 75, 76, but menopause doesn't go away. So till the time we are breathing, I think we can just keep these exercises.
It won't go away.
It doesn't go away. It doesn't go away.
So till the time you are here, it stays, and you have to know to deal with it.
Absolutely. I think more than that, accept it. That's very important.
Perfect.
Yes?
Perfect.
Good?
Perfect.
Thank you so much.
So I think the attention is also thinning.
Yes, it is.
Evening is extending.
Yes.
We never anticipated it to go beyond 2 odd hours. We've crossed about 2.5 hours.
हमको तुमने मार्कर नहीं दिया ना 3-3 मिनट का, हमने देखा ही
I
नहीं.
have not been strict with
I know.
young girls.
Because he himself is also like that.
So I'll request my audience to have any questions. We can always join in with this. Tanu, please.
Hi.
There are a lot of forward bending movements that are holding up exercises. So what if someone has low back ache, glaucoma, eye issues, Like
Yeah.
I already have a low back ache, so the forward bending can be modified.
Absolutely, absolutely. See, the idea is, one, these are general exercises. If you're already under some kind of a medical condition, always speak to your doctor. But in my experience, lower back pain, one of the main reasons is weak pelvic floor anatomy, weak pelvic floor muscles. One of the main, most important causes. The minute we hit 35, as the estrogen starts depleting, everything in the body kind of starts collapsing. Therefore, minimalistic, consistent strength training, you can start with your body weight, but address the lower back issue. Please understand where it's coming from. A lot of doctors say because you have lower back pain, please don't bend. Sure, when you're in pain, don't bend. But you cannot not bend all your life, right? At some point of time, you have to bend. So allow the body to kind of adjust, heal the body, take your own time, but just don't stop doing movements because at one given point of time you were in pain and you were told not to do it. So yes, there are a lot of variations, and maybe we can speak later, and if there's anything I can share.
What is the name of this elastic band you had shown? Is there any particular name?
These are loops. Loops, resistance loop. Amazon. Everything's on Amazon. So there are TheraBands, these resistance loops, then there are these power bands, lots of stuff. But it's these are called loops, and they're, I think, in 3 or 5 colors depending on the strength. So always start with the most light, and then you can progress.
You get it on Amazon, various kinds. I have it.
Yeah,
And my last question.
Yes, please.
Ma'am, I've been suffering from this frozen shoulder since past 1 year, and I've been to a lot of orthopedicians, and nobody could find out any reason. So one of my gynecologists told me that it is perimenopause. So now what do I do about it? Because there's no treatment. I've been through multiple treatments. Could you suggest me any particular movement which would relax the fascia, like you were talking about fascia a lot?
So, see, frozen shoulder, one, the main cause could be estrogen, but until unless I don't do an assessment, I cannot comment, because frozen shoulder एक है, but उसके causes कितने सारे हैं. So, मतलब you can't, जैसे अब किसी को lower back pain है, तो आप मतलब 10 patients को आप वही same exercise नहीं दे सकते. You cannot. Every individual's rehab is personal, it's different. So for me to say, okay ma'am, do this exercise, it'll get better, I'm sorry, it doesn't work like that. So yes, if you do have an issue, again, we can speak one-on-one, and maybe if I can, I'd love to help you.
So I would suggest one thing. Everybody join this collective. It's free to join. You don't have to pay any money. There's no screening or something
Absolutely.
like that. And there you are able to reach out to everybody.
So many of us.
You have 7 panelists here, but we've got 64 panelists on that collective from various parts of the world, various fields, gynecology, even astrology. Medical astrology is also one of the things. Madhurji is very active there. She's always active. All right. Any other questions?
Thank you, ma'am.
Most welcome.
Any other questions? So if there aren't any, and we would try and wrap up the show.
I think it's done.
No?
Yeah.
Not ready? For the YouTube live, let's try. So I would want.
Actually, you invited the dentists
Yes.
who are practicing.
Right.
Their practice again starts at 5:30. So they are leaving.
All right.
That's why they are leaving.
Perfect.
Sure.
I should have kept this in mind.
Yeah. A lot.
So my request will be Dr. Trita, Dr. Guru, sorry. Yes. So Dr. Guru, just come and close the ceremony, and after that we ask.
So I would like to thank you all for coming here and spending your valuable time to be here with us. And before we end, I would like to say, girlies, please pat your back. If you are here, you found some time for yourself. You think that is very important. And another thing, जो मैंने हमें पता है, maybe subconsciously we don't work on that actually. मैं इससे सफर करती हूँ, and I'm very sure each one of you, will relate to that. मैं ठीक हाँ syndrome. Everyone has that.
Yeah.
When he comes, I can manage everything
Nothing can happen.
well enough. मैं दुर्गा हूँ, कभी कभी we need to settle down the inner Durga. So you know, give that inner Durga a bit of rest. Learn to appreciate yourself, slow down, and there's no harm in doing that.
Perfect.
And do it gracefully, girls. So pat yourself, please. We have few guests to honor, and I will request Kavita ma'am to please join me in honoring those guests.
Okay. Ladies, please put your hands together to welcome our distinguished guest of honor, Ms. Nazneen Tiwari. Ms. Tiwari has dedicated 32 remarkable years to the aviation industry as a distinguished air hostess. Having retired 3 years ago, she continues to embody the values of good thoughts, good words, and good deeds by helping the poor and the needy. So please put your hands together for her.
Oh, better.
Thank you so much, the ladies and all the ladies and the gentlemen. I mean, I'm really honored. City Beautiful has a fantastic team of, women and youngsters. You're doing a fantastic job. Okay? Thank you so much. Thank you.
Now please join me in welcoming Hardeep Bakshi. She is a clinical dietitian and certified diabetes educator with nearly 30 years of experience in clinical and functional nutrition, diabetes care, weight and lifestyle management, with a special focus on women's metabolic and hormonal health. She works with various city hospitals.
Great. Thank you so much. Joining in.
And was trained at Postgraduate Institute of Medical Education and Research. And she is also working with corporates as a therapeutic dietitian and preventive healthcare consultant.
I was wondering, this is the only aspect which was missing in the whole conversation. So I can only say that menopause is not a disease. It just says pause and start loving yourself and start fresh. That's the That's okay. No, that's not good.
Now, please join warmly welcoming Professor Gurpreet Kaur, Chief Executive Officer of MSI Group of Institutions, with over 25 years of experience in higher education and governance. She's a strategic institution builder known for creating inclusive, high-performance academic ecosystems. Would you like to say something?
Of course.
Gurpreet?
Thank you so much. What an insightful session, and it was truly my privilege to be part of this session. All I want to add is, जो बातें कहीं नहीं जाती, वो कहीं नहीं जाती. So we must express. और मैं थोड़ा सा डिफर करती हूँ. Everybody was talking about relationship issues and all that. First and foremost, we have a relationship with our own self. I'm a single mom, proudly a single mom, and I'm blessed because of two things in my life. I have best of friends. इसलिए वो जो relationship वाला missing है ना, वो boyfriend, वो lover, वो husband. So I disagree on that part. But due respect to all the husbands and lovers and whatnot. But yes, in my life, I have my sister from the other mother sitting in the audience, Rasna Singh. She's the one who takes all my chaos, all my stress, every single day, morning and evening. I talk to her, I seek her advice, and she is my spine. She's my strength. I express everything to her. And next is my elder sister, just standing next to me, Amrinder D. For you, it is that she's my Daisy D. We have met just I think a year back, पर मुझे लगता है कि एक साल में वो relationship बन गया कि 50 साल की मैं हूँ and 49 years I've wasted because she was missing in my life.
because of my profession. So yeah, we've been talking so much about everything. We have so many defined and undefined roles to play. But it is very imperative that we talk to our own self. I have a beautiful relationship with my pillow. As I said, I'm proudly single. I have a very beautiful relationship with my blanket, with my home. I love my home. That's my safest, most beautiful place. और जब आपने बोला ना कि आपकी बॉडी का सबसे सुंदर पार्ट क्या है, although I've been abandoned so many times for so many reasons from so many relationships from the age of 3 till now, the most beautiful part of myself is my heart, because I have never stopped loving, I have never stopped caring, and I will love more and I will make that mark. Whether or not you are capable of reciprocating to me, I am well capable and enough to love each and all. Thank you so much.
Now I request Amarjeet Kaur Gill. She's a senior manager at the Times of India, Chandigarh. She holds Master in Business Administration degree from Pune University and has 15 years experience in corporate world. She handles customer operations and out-of-home leadership for Chandigarh region. Thank you so much for being a part of this small little event that we did. Yes.
Just saying, feeling wonderful here would be a very generic term for all of us. We all, as a woman, keep on talking about this topic more or less every day. Once we cross our 30, this topic becomes like a joke for every one of us. But beautifully, you guys have taken an initiative to make it more meaningful discussion is what I really appreciate. All I would like to say as a woman, we all know what to do. We believe in ourselves, we know the solutions ourselves. All we have to is find how we want to work ourselves more. For me, what works may not work for you, but inner happiness is our own. We have to have a disciplined lifestyle, routine se bahar nikal ke whatever makes us happy. Like the exercises you told me, what do you do when you go back home to relieve? What I do is, I take my dog out for a walk. Wow. At 45 minutes with me and my dog is my happy space. Then I enter the kitchen. Then I think what kya banega, kisko kya khana is later on. Those 45 minutes is mine.
But you know another thing, you have to have the courage to take out that time for you. Yes.
Yeah.
That is very important.
Yeah.
That is very important. That boundary that this is my time.
Yeah,
and that's it. You know?
That's it. That really matters. We all have a very busy work life, so much responsibility, team ko handle karna hai, udhar bhagna hai. But what? Just 1 hour for ourselves, every woman can do it. And we all can do it. So this kind of forums is really, I appreciate Team IDA and Sir for bringing it up. We are definitely going to join it. I'm supposed to join on Instagram or
we are always there.
LinkedIn. Do please share everything with us. Such an informative session. Thank you and all the good luck for the team. Thank you.
Now I call upon somebody. I'll call them 2 names. One of them is supposed to be the most beautiful woman in my life. And the other one is somebody who speaks really well. I heard your voice the other day, the way you speak. Please, Arjashita, please.
I'll say this, thank you so much. But first I want the mic hand, because it's so difficult for an Arjun to sit quietly. To be very honest, I have to be very candid here. Honestly, you know what, being an RJ, it's 9 years in the city. I'm a Delhi ki ladki. You know, when I came in 2017 in Chandigarh, it was certainly the most, I think, life-changing experience. I'll take this. These are lovely. मैं पूरा सम्मान लूँगी, but मैं पहले बोल लेती हूँ because ये opportunity मेरे लिए. See, I'm a layman when it comes to the medical field. I'm not from the medical field. And जाहिर सी बात है. Firstly, I have to compliment two ladies over here. Every one of you is amazing. The two amazing speakers, I must say, Poonam and Dr. Madhur.
No, I'm not a doctor.
Because I came in the middle of the event. But you guys speak like an RJ. Firstly, compliments to two of you. You didn't hear on I missed. I am so sorry, but हम तो चलो टच में रहेंगे. But there are so many faces जो मैं पहली बार मिल रही हूँ.
Sorry, I'm cutting you short a bit. Are we in race? Right.
Are we in, you know what, I'll tell you something. Wonderful women, people who firstly say that women do not support women should completely come and attend events like this. And I think this popular opinion about औरतें से जलती हैं वाला has been also created by some misogynist men. ऐसा बिल्कुल नहीं है. It's very, very important for us to firstly understand that, you know what, each one of you, I was actually watching how beautifully we are embracing the fact and, you know, we are accepting it and we are not judging. We know that हर औरत यहाँ जो बैठी है सबका अपना संघर्ष है और उसको सुनने की कैपेबिलिटीज जो है कितनी खूबसूरती से हम लोग सुन रहे हैं. So you know what, this generation जिसने हमें आज तक बताया है औरतें को सपोर्ट नहीं करती है, साइड दिस एग्जाम्पल के बिल्कुल करती है. और वो ऐसे इवेंट्स में पता चलता है कि हम लोग एक दूसरे की कहानियाँ, you ma'am, more power to you. This feeling of getting abandoned, you know, and from the age of 3 till now, how you beautifully own it, I have to tell you, this is so beautiful. हमारे देश में इस परंपरा को अपनाया नहीं जाता है कि टॉक्सिक पेरेंटिंग भी होती है, you know, और खास तौर पे वो बेटियां जो सशक्त होती हैं बचपन से ही, उनको सबसे ज्यादा चैलेंजेस मम्मी पापा से फेस करने पड़ते हैं. और इस चीज को अपनाना होगा कि हर पेरेंट बागबान के अमिताभ बच्चन और हेमा मालिनी नहीं होते हैं. Me being an RJ have voiced it out on Red FM. Now coming to Red FM, we are the #1 radio station of Tri-City. I host a show every morning. It's a mid-morning show, 11 to 2. And ये जो मैं शो करती हूँ ये जम्मू में भी जाता है, अमृतसर में भी जाता है, राइट, पिछले 9 साल से कंसिस्टेंटली. अब मैं आप लोगों को जो कहने वाली हूँ वो बहुत ही प्रोफेशनल और बहुत ही इंपॉर्टेंट चीज है. ये इवेंट बहुत अच्छा है. I'll be very honest, बहुत अच्छे से आप लोगों ने क्यूरेट किया, आप लोगों ने बहुत सारी टेक्निकल चीजों के बारे में बात करी, बट ये लेमन तक कैसे पहुंचेगा? For that it's very important people here, the faces from the medical field. IDA के जितने भी लोग मेरे साथ यहाँ पर जुड़े हुए हैं, especially you ma'am and everybody else also, please understand, हम प्राइवेट एफएम रेडियो स्टेशन रेड एफएम को रिप्रेजेंट कर रहे हैं, बट इट डज नॉट मीन कि हम सिर्फ गाने बजा रहे हैं. There are incidents, there are occasions जहाँ पर हम इन मुद्दों के ऊपर बात करना चाहते हैं, but आप don't mind me saying this, I don't get leads, you know, because then you guys think we are only and only approaching the government radio stations. वो करते हैं, ये लोग का entertainment करते हैं. No, we do entertain, but then we also integrate the idea of what you want to say. For example, the other day I went to the Max Hospital. I was speaking to the director of oncology there. The other day, before yesterday, maybe I think कल की बात है, Global Hospital Mohali के director of oncology was with me in the studios. तो हम लोग यहाँ पर collaborations करते हैं. Now me telling you this is that I'm on Instagram and LinkedIn and Facebook and Twitter and I don't know how many other planets. RJ Shatabdi, you can connect with me, share your number with me. Dr. Tripta has done that already. I would just like to say Red FM is very much open for the leads. Yes, there will be commercials involved if you're running any sort of advertisements, any podcast, any interviews. But अगर आप कुछ बोलना चाहते हो उसको bigger level पे करना चाहिए. मुझे personally ऐसा लगता है, जो मुझे लगता है, और हमें इसमें entertainment भी डालना होगा, क्योंकि जिस generation में हम हैं जहाँ पर लोग 30 सेकंड के रील में देखते हैं तो बोर हो जाते हैं. उनको कुछ ऐसा चाहिए जिसमें मजा भी हो और इंफॉर्मेशन भी हो. लेट्स बी ऑनेस्ट, यू नो. तो मैं क्योंकि यहाँ पर थी तो मैंने ये चीज ऑब्जर्वेशन मेरी रही है कि हम इसे और एंटरटेनमेंट बड़े लेवल पे कर सकते हैं इफ यू कोलैबोरेट विद रेड एफएम. आवर फ्रीक्वेंसी इज 93.5 रेड एफएम. Please connect with me and I just want to say wonderful meeting all of you all. मैं रेडियो पर डेफिनेटली मैंने इंटरव्यू तो लिया है अभी. आई हैव टेकन सर्टेन बाइट्स. आई वुड लाइक टू गो अहेड एंड से दैट प्लीज आप लोग आइए रेडियो स्टेशन में, आइए और इन चीजों के बारे में बात करिए, क्योंकि मेरे लोग आई एम अ प्रीटी फेमस आरजे, यू नो, आई नो दैट. सो काफी लोग सुनते हैं, काफी लोग सुनते हैं. अगर यहाँ पर 50-100 लोगों ने सुना है तो वहां पर यकीन मानिए हजारों की तादाद में आपकी आवाज जो है वो हमारे रेडियो स्टेशन से लोगों तक जाएगी. और सिर्फ ट्राई सिटी नहीं जाएगी, जम्मू भी जाएगी. और मेरा शो वैसे ट्राई सिटी तक ही नहीं जाता है, हमारा भी क्रॉस करता है, so I receive calls from the listeners every day. So please connect with us. Welcome India is our national page. My page is RJ Shatabdi. And honestly, जब मैं आने वाली थी यहाँ पर मुझे ऐसा लगा डॉक्टर के बीच में मैं क्या करने वाली हूँ? You know what? I think they're so intelligent people, so learned, इतने विज्ञ हैं ये लोग. What am I going to say? But you know what you guys have made, so comfortable. I felt very comfortable. And you speak like an RJ. I'm telling you this thing again and again, and you too. आप लोग बहुत अच्छा साउंड करते हैं. You are so good. दिल्ली की लड़के, दिल्ली NCR की लड़के ऐसी होती हैं. Our body language is very confident. और ये चंडीगढ़ में आकर के मैंने देखा इतने मतलब you guys accept a non-Punjabi girl like that in these 9 years. मुझे बड़ा अच्छा लगता है. मैं पंजाबी भी नहीं हूँ, ना मुझे पंजाबी समझ भी आती है. कोई पंजाबी लड़का फ्लर्ट भी करते हैं, मुझे वो भी नहीं समझ आता है. सुबह में 9 साल में आप लोगों ने बहुत भरपूर प्यार दिया है. भैया जी जो पीछे हंस रहे हैं, so more power to you as well. मुझे बड़ा अच्छा लग रहा है आरजे को यहाँ पर सुन रहे हैं. You, I think to the camera person here as well. यार बड़ी देर से उस लड़के को हम लोग इधर उधर कर रहे हैं, but fabulous job to you as well. तालियां होनी चाहिए for this entire collaboration, women, people who have organized it, and so आपका तो बड़ा सही है, मतलब आप औरतों से घिरे ही रहते हैं.
That's what he said. He's a kanaiya.
है ना? And I am also a devotee of Krishna. So मैं हमेशा कहती हूँ कृष्ण सदा सहायते, और हमेशा इस चीज को याद रखिएगा कि वाकई सही बात है. कृष्ण जो है वो सहायता नहीं करते हैं, वो जहाँ खड़े होते हैं समस्त जितनी भी प्रकृति है उसकी सहायता करती है. This is what I believe. So hand in hand with our culture, with the mortality and with the enthusiasm. Thank you so much, ladies. It was wonderful meeting all of you.
Whatever she is saying, she's so right. I didn't know her personally at all. I just connected on Instagram. She immediately responded and she agreed to come. And I want to give her a big round of applause for that, because I was not expecting this. I never expected that she'll respond like this. She was so comfortable to come. Thank you so much.
Thank you so much. Thank you. Thank you.
मैं कहना चाहूँगी कि तुसी पंजाबी भी बहुत सोहनी बोलते हो. बहुत सोहनी बोली. तुसी पंजाबी आ रहे हो.
मुझे सिखा. I'm very open to learning Punjabi also, but I'm a कायस्थ की बेटी. I'm a भटनागर. तो हमारे यहाँ पर थोड़ा यूपी का हमारा वो रहता है, because हमारी roots वहाँ की है. तो मेरा हिंदी और अंग्रेजी में बड़ा फोकस रखा गया है परिवार द्वारा.
You're better than the Parsi from Mumbai who speaks absolute khichdi.
ये पंजाब की खूबसूरती है. देखिए ये पंजाब की एक्सेप्टेंस की एक्सेप्टेंस बहुत खूबसूरत है यहाँ पर. मुझे जितना प्यारे शहर ने और जो बरकत मुझे दी है ना पंजाब ने, ट्रस्ट यू मी, मैं बहुत शुक्रगुजार हूँ और धन्यवाद है कि कर्म भूमि है मेरी. and I'm very happy that I'm working here. So yeah, I mean, because of any Dominic and Harry reasons, if I have to leave the city down the line, वो एक अलग बात है.
ये कह सकते हैं कि दिल्ली की कुड़ी है पंजाबी पंजाबी और
Thank you so much. Thank you so much, RJ Shatabdi. And I would want me to join hands and present the gifts.
Come everyone. And the NCR girl, I'm in love with her. Please come. Everyone, yeah. हम लोग ऐसे फोटो ले लेते हैं.
I mean, let's take a
picture.
Selfie, yeah.
The camera person is. What's your name? What? Sambhav. Very good job. Very patient with the women.
Look at you.
He's a green forest.
Look at you.
Yeah. Let's take a selfie.
How many can sit on the floor?
Hi. I can say exactly, ma'am. I can say.
So much easier. Come, getting up.
He had already mentioned comfort.
Yeah, absolutely. Come.
At Red FM music बजाते रहो. Please, so let's together say Red FM बजाते रहो. No, sir, please come and join in, sir.
How can you have only one kanaiya? No, we have two kanaiya. That's what I'm saying. No, now.
All right. So on the count of 1, 2, 3, we're going to say Red FM बजाते रहो. 1, 2, 3. Red FM बजाते रहो.
Thank you.
Thank you so much. Thank you.
And now,
Thank you.
Shreya ji is having
the force behind this man.
Beautiful lady is there.
Yeah.
What's her name? Navneet.
Yes.
and I would definitely want everybody to give a heartfelt thanks to all the people who have joined from the panelists side. I would want to thank Dr. Moheba. She is on a water fast also. I mean, she's not even supposed to have water today.
She is Ramzan. Lavon has been absent for 3:30.
3:30, Lavon, thank you so
That's
much.
all. Thank you guys. Thank you so much. Srividya, thank you. Dr. Hitesha, nice to meet you.
Thank you so much. Dr. Hitesha, thank you so much for joining in and sharing all the knowledge to us.
No comment.
Thank you so much, panelists. We'll switch off the recording and Thank you so much. Dr. Yatisha, thank you so much. That was brilliant.
That's okay. I think it's all about the mindset.